founder of Panoptic Strategies and our very own Washington insider who loves to dress up her dogs in even outfits that PETA wouldn't approve. That's right, it is none other than the Gretchen Gailey.
My dog outfits are wonderful, and I think that HHS would approve of them, just like they approved and are urging to move pot to a lower risk category. U.S. health officials are recommending easing restrictions on marijuana, a move that sets the stage for potentially expanding the cannabis market across the country. A top official at the Department of Health and Human Services wrote Drug Enforcement Agency Administrator Ann Milgram calling for marijuana to be reclassified as a Schedule III drug under the Controlled Substances Act, according to a letter dated August 29th that has been seen by Bloomberg News. A DEA spokesperson confirmed the department had received the letter with HHS's recommendation, with final authority to reschedule a drug. DEA will now initiate its own review, the spokesperson said. Reclassification is a step short of legalizing the drug entirely, but it would mark a critical shift away from marijuana status as a Schedule I substance, which includes drugs with high risk of abuse like heroin, LSD, and ecstasy. Schedule III substances such as ketamine are seen as less dangerous and can be obtained legally with a prescription. It could also give President Joe Biden an accomplishment to point to ahead of next year's election, while reducing the taxes that cannabis businesses pay. Cannabis advocates say that rescheduling would be an acknowledgement by the federal government that marijuana has legitimate uses and would be one step on a path towards greater acceptance and availability. Marijuana stocks, which are held more by individual than institutional investors, jumped on the news. The MJ Pure Play 100 Index, which tracks cannabis stocks, rose 13% on Wednesday, pairing its year-to-date decline to 21%. And Columbia Care Incorporated gained 39%, and Our Wellness Incorporated climbed 29%. Biden rolled out new initiatives focused on easing penalties associated with marijuana use in October, pardoning all prior federal offenses or simple possession and urging governors to do the same with state offenses. He also asked the HHS Secretary and the U.S. Attorney General to review how marijuana is scheduled based on its medical use, potential for abuse, safety, and potential for dependency. On Wednesday, White House Press Secretary Karine Jean-Pierre said in a briefing that HHS and the Department of Justice, which oversees the DEA, were engaged in an independent process that's guided by evidence. We're going to let that process move forward, she said, declining to comment further. Marijuana is the most commonly used drug in the U.S. that is illegal at the federal level, according to the Centers for Disease Control and Prevention. About 1 in 5 Americans used it at least once in 2019, according to the agency. Its current status as a Schedule I substance indicates a high potential for abuse with no accepted medical use, along with a lack of accepted safety for use under medical supervision. Yet, that conflicts with many states' rules that allow the drug to be used recreationally and prescribed for treatment of everything from glaucoma to anxiety. Moving the drug to Schedule III would be the most significant federal cannabis reform in modern history, said Edward Conklin, Executive Director of the U.S. Cannabis Council. Cannabis should have never been scheduled alongside heroin and placed at the center of our nation's destructive drug war. Thankfully, that era is coming to a close, and it's being replaced by a modern and scientific approach to regulating this plant. Rescheduling wouldn't give the industry a comprehensive regulatory framework. The biggest impact would be to give beleaguered cannabis companies a tax break and make research on the drug easier. Prior restrictions meant that cannabis companies couldn't take the same kind of tax deductions as most companies, and its Schedule I designation meant it was hard even for academics to study the drug. HHS's recommendation was based on an extensive FDA review of marijuana's classification. Assistant Secretary for Health Rachel Levine said in a letter to the DEA, the FDA considered 8 factors that determine the control status of a substance and recommended that marijuana be placed in the Schedule III category. The National Institute on Drug Abuse agreed with the FDA's recommendation, according to Levine. An HHS spokesperson said the department's comprehensive scientific evaluation was completed in less than 11 months in an effort to respond quickly to the president's directive. It's a huge day for the cannabis industry, said Brian Barish, co-chair of the Coalition for Cannabis Scheduling Reform, an advocacy group and deputy general counsel of Dutchie, a platform for cannabis commerce. We would just hope that the federal government follows through on their recommendation. Some cannabis industry advocates said the recommended rescheduling doesn't go far enough and it won't fix the clash between federal law and the 38 states that allow for medical use and 23 states that allow for recreational use. The move would do nothing to align federal law with the states, with each have their own laws to regulate it, said National Cannabis Industry Association CEO Aaron Smith in an emailed statement. The only way to fully resolve the myriad of issues stemming from the federal conflict with state law is to remove cannabis from the Controlled Substances Act and regulate the product in a manner similar to alcohol, said Smith. For once, that's one thing I agree with Aaron Smith on. Yes, yay, Schedule 3. It's going to get my semi-happy jazz hands because it helps with 280E, but I think it opens another quagmire of problems for this industry. But it is a huge step forward. But bear in mind, for all those who are getting excited, the DEA still has to approve this. And I don't believe they're going to just approve it tomorrow. Their review scheduling could take quite a while. This is Gretchen for High at 9 News.